starting, and here is your question. You can take your time. Oops, sorry. So this is just the beginning.
Okay.
You can read now.
Okay.
Okay, next.
Okay.
Yes, that's it. If you want me to go back and read, then you can take your time.
No, it's fine.
All right, so if you're ready, we can begin.
Okay. Hello,
All right. Yes, begin.
hello, I'm the SHO working for Mr. X. I'm calling to speak to the trauma head to update him about a trauma case with a vascular injury. Could I check that I'm speaking to Mr. X?
Yes, I'm here. Summarize your case, please.
Okay. Mr. X is 20 years old male who is presented to us with a road traffic accident. On examination, patient has abrasions on his abdomen and also has open tibiofibular fractures in his left lower limb. Patient hemodynamically stable and the GCS is 15, but no pulses felt in his left lower extremity. His blood is normal, but only shows an increased CRP. We did imaging and ultrasound. Abdominal ultrasound indicates a free abdominal fluid collection. So
Okay,
I wanted to update you about this case.
Okay, and you mentioned that the bloods are normal. What is the hemoglobin level of the patient?
Sorry, but I will check for this and update you.
Okay, and regarding the finding of the patient, what is the most urgent?
Okay, the most urgent thing I think is the open fracture with arterial injury, because the patient might go in hypovolemic shock and might have ischemia to his lower limb together with compartment syndrome.
Okay, and is this limb salvageable?
Yes, it's salvageable.
Okay, and what do you think is the cause of the ischemia in this patient?
I think because of the vascular injury, patient might have lost a lot of blood, and the blood cannot reach the extremity of the lower limb, so he might get ischemia together with compartment syndrome due to the excessive damaging trauma and the crushing injury of the lower limb.
And how many fluids did the patient receive?
The patient, I will check and I will update you.
Do you think he is dehydrated?
No, the patient is hemodynamically stable.
Okay, and is the patient wearing a cervical neck cooler?
I will check for this also because it's not written in my notes.
And what is the immediate management of this patient?
The immediate management for this patient is according to ATLS protocol, is looking for airway assessment and management, so together with cervical spine stabilization by semi-rigid neck collar to sandbag and tape, and checking for the airway if patient is talking to me, so his airway is open. And if he's not talking to me, I will start with simple maneuvers as jaw thrust and chin lift, together with some adjuncts like insertion of oropharyngeal tube, and also I might need even endotracheal intubation together with cricothyroidotomy or even tracheostomy if needed. And then I will check for the breathing. I will start by doing inspection for the symmetrical expansion of the chest, for looking for the position of the trachea, and listen. And also I will listen for the presence of stridor or hoarseness. And also I can palpate the patient and for the chest for any fractures and any crepitations. And I will ensure the patency of the breathing. And if there is any open fracture in the chest, I will do a three occlusive dressing together with the suspicion of any pneumothorax or hemothorax. I will do a needle thoracotomy together with a chest tube, and I also will check for the circulation. If the patient, I will check for the mental status, and I will check for pulse oximeter in his extremity, and I'll check for the color and temperature of the skin. Also, I might need the ECG done in the CPR together with counting the heart rate, and I will put two large bore cannulae, one for administration of resuscitation fluid and other for drawing of some bloods such as hemoglobin, prothrombin, coagulation profile, liver function tests, lactate, ABG, and I also will look for disability. I will check for the GSS, which already have been checked for the patient, and exposure for any wounds inside him, and any dressing I will check for it. And also I will check for his lower limbs for any DVT, old DVT. But also I will log roll the patient by using 4 physicians, one stabilizing the head and neck and the shoulders, and the two others beside the patient, and they roll the patient to them side, and the fourth physician remove the rigid board beside him and check for any fracture, for any wounds or fractures in the back of the patient, and then reposition the patient in the previous position.
Okay, and who would you like to involve in management of this patient?
I'd like to involve a vascular surgeon, an orthopedic surgeon, together with a general surgeon, also consultant, because the patient has intra-abdominal free collection. Also, might inform the ITU registrar for the possibility of need of a bed, because the patient might have a two system affected by this massive trauma. And also I will cross-match 4 units of blood for the patient.
Okay, and what is your management of the fracture? Immediate management of the fracture now?
Okay, I will reduce the fracture, and also I will order CT for the pelvis, and yes, for CT for pelvis for the presence of any fractures. And for the sake of the patient, I will also order a CT abdomen, CT head, and CT brain.
Okay, notify me if there is anything new.
Okay.
Did you mention CT low limb angiogram?
No.
Yes, that also you have to do. If pulses still you cannot feel, then you'll do that.
Okay, CT. Okay.
Okay. What other investigations would you perform before sending over the patient?
I will do the whole primer survey, and such as for sure CT head and the brain.
Primary survey you have already done. Now, how many
Okay.
surveys you do? Secondary survey or tertiary
Yes,
survey maybe?
secondary. I don't know the tertiary. I know secondary.
Okay.
Secondary survey, I will do CT for abdomen and
Yes.
pelvis.
Yes.
And also the CT lower limb and angiogram also from a secondary survey.
Yes. Right. Yes.
And abdominal ultrasound, that's the first primary survey.
Fast scan or abdominal ultrasound, that is already done in primary survey.
In the
Okay.
primary survey.
Did you mention that you'll do the wound debridement of the wound, dirty wound, and then you'll take care of the compartment syndrome, and then you'll rule out intra-abdominal injury? That should be your first immediate plan of action. These three.
Yes. Can you tell me
Again?
Can you tell me yes another time?
Yes, because see, there is right tubular open fracture. So first,
Yes.
you'll do the debridement of this dirty wound, right?
Okay.
And then you'll also do you'll take care of the compartment syndrome, because pulseless. How do you monitor or how would you take care of the compartment syndrome? So the conservative management, you'll take care of that. And then since there is free fluid, then you'll also rule out any intra-abdominal injury. So if there is abrasions or anything, you'll make sure which viscera can be injured. Is it liver or is it spleen? Which side is it?
Okay.
And you'll manage yes, you'll manage the patient before you'll prepare or you'll inform the general surgeon, and you'll be preparing the patient for exploratory laparotomy.
Okay.
Yes.
Okay.
So these three things are very
yes.
important. Yes.
Okay. And after irrigation of the wound, I will do also packing of the wound and do tourniquet for the bleeding.
For the compartment syndrome and then intra-abdominal injury, you'll rule out.
Okay.
If patient can be managed, because so far, so long after primary survey, patient is hemodynamically stable. But since the patient has an open fracture and see that is grossly soilage, so that you have to take care of. And you have to make sure the patient has had a tetanus injection or tetanus toxoid, or if not, then you will make sure that is arranged. And there are abrasions on the left flank. So left flank is a splenic injury, most possible, and there is abdominal distension and tenderness. So that you have to monitor. And then extremity. So these are the 2-3 things that you have to do in immediate plan. And then, yes, the other plan, you'll hear the recording again. I would want you to write your plan and say it in 1 minute. Okay. You took 2-3 minutes, 3 minutes more. So your whole plan should be like a vision in front of you, that what will you do first, second, third, fourth, fifth. So you have to mention it quickly as well. Like, I'll do this. And whole plan should be in front of you, in your mind. Clear.
We should figure all the steps of ATLS protocol, or just
Yes.
memorize them by saying adequate airway and breathing and circulation.
First breathing, and then what he said, that since patient is talking, he said after taking care of the cervical spine, he'll listen to the recording. So first you have to mention that since patient is talking, GCS is 15 on arrival, so I assume patient's airway is patent. Then I'll take care of the cervical spine. And then whatever he told that he'll manage it with the sandbags and the tape. And then breathing, then you can say, okay, he'll do another look at the breathing of the patient. And since patient he is hemodynamically stable, so he assumes breathing is okay. Then he'll come back to circulation. So then for circulation, okay. Since there is open fracture, so he has to take care of the circulation of the patient. And then he'll look for any deformity, if there is any deformity or etc. So that's how he proceed. And before that, he can just quickly mention all the points which are given in the ATLS protocol quickly, without, yes, wasting time. So good, excellent.